welcome to Wimpole Street Dental Clinic. My name is Christian. In the following small video we would like to show you how we can recreate big bone volume loss with your own autologous bone. We call that bone block grafts. So it's a very interesting technique which we can use to recreate or regrow bone which has been missing due to inflammation or other problems in your mouth. Thank you so much for your time, and we really hope that you enjoy the following video.
Here you see the intraoperative situation of the right lower jaw in the region where the wisdom tooth was. The structure here is called the linea obliqua, and you can see already the bone graft we've carved out of the residual bone, indicated by the yellow arrow. And you can see with the blue arrow the tooth number 4-6, so that's the first molar in the lower jaw right. And you can see how we transplant the bone. The yellow arrow again indicating where we've taken out the transplant, the small blue arrow indicating where we put the transplant to, and the green arrow shows small particulated bone material we harvested as well from the retromolar region. That means the region of the former wisdom tooth. And like when you build bridges with concrete, first you need the wood to facade the later on structure. We do exactly the same here. We use the split bone graft to recreate the anatomy of the alveolar bone, the anatomy of the lower jaw bone. And this bone in the very back, where we've taken out the bone, is healing without any complications, and the bone will grow back. It needs roughly 4 months to heal. Then we place the implant. So overall, after 7 months, because the implant needs to heal another 3 months, we can expose the implant to the oral cavity and then take an impression. On the right side, you see a tooth prepared for a full ceramic crown, and on the very left you see as well a tooth prepared for a full ceramic crown. And in the middle, the blue post is the so-called impression coping, which you use to transfer the position of the implant to the dental laboratory, so that the dental technician can then produce your crown. On the very right you see the canine on the lower jaw right. Here, this is the final situation with 3 crowns placed into the jaw. Thank you very much for your kind attention.